Okay, in this video, we're going to look at what are called the precordial leads. Now, you'll notice the word cordial meaning from the heart, heartfelt. So precordial basically means in front of the heart. What we've looked at to this point were the limb leads. All right, so your limb leads. And if you recall, so let's draw our person here. So here's our person. And we put an electrode at the right arm. We put an electrode over here on the left arm. We're going to be more specific as to where those go, right leg and left leg. And from this, we were able to get Einthoven's triangle. You had lead 2, lead 1. I'll even put the polarity there, lead 3. And then starting in the middle, you could get the augmented limb leads, AVR, AVL, and AVF. And so we had 6 limb leads, 1, 2, and 3, AVR, AVL, and AVF. Now, a full EKG is 12 leads. Well, these are only 6. So where do these other 6 come from? Well, let's come down here and take another look. So we place 6 additional electrodes on this individual. And what I'm going to do is I'm just going to do a rough sketch of this individual's sternum. So let's just assume their sternum is right here. And they have ribs, of course. And so I'm just doing a rough sketch of some ribs here. Hopefully this works out well. And even their clavicle. We'll put a clavicle up here if we can. So this is just a very rough sketch. So we'll put the right arm electrode here, the left arm electrode here, the right leg, and the left leg. So before we get to the precordial leads, I'll go ahead and tell you these 4 electrodes, how we locate their, where we put those. So left arm and right arm are very similar. And so what we do is we identify the clavicle, and about in the middle of the clavicle, just below it, we're going to put the right and left arm electrodes. So you have to identify where the clavicle is on the person and place those electrodes just below the clavicle. So they're mid-clavicular, just below the clavicle. What about right leg and left leg electrodes? Well, as you can see, they're very similar. Also mid-clavicular. So you have to line that up with the middle of the clavicle. So basically, if you put on your right and left arm electrodes, you can just go straight down from there. And you go down until you get below the last rib. So just below the last rib. And place those electrodes. And that will give you leads 1, 2, 3, AVR, AVL, AVF. So what about these precordial leads? Well, what we're going to do is we're going to look at spaces between the ribs. And so you actually have to palpate. You have to feel the ribs on this individual. And you have to identify the first rib. And then the space between the first and second rib is called the first intercostal space. And then you look for the second intercostal space, the third intercostal space. When you find the fourth intercostal space, we're just going to say 1, 2, 3. We're going to say it's right here. You're going to go just to the right of the sternum in that fourth intercostal. And that's where you're going to put the first one. We're going to call it V1. So I'll start making a list here. V1 is in that fourth intercostal space. Inter means between. Costal refers to the ribs. Fourth intercostal space. And this one is to the right, just to the right of the sternum. You don't want to put it on the bone. You want to put it just to the right. And then what we're going to do is we're going to go to the other side of the sternum and put V2. So the same thing goes for V2. It's that fourth intercostal space. I'm just going to put quotation marks so I don't have to write all over again. Except it's to the left of the sternum. Now, we're going to skip V3. You'll see why in a minute. And we're going to go straight to V4. So for V4, we have to drop down to the next intercostal space, the fifth intercostal space here. And we're going to go midclavicular. All right. So we're going to draw our V4 electrode right here. That's V4. So V4 is now in the fifth intercostal space. And midclavicular. Fifth intercostal, midclavicular. Now we can go back to V3. Technically, V3 is directly between V2 and V4. I don't know why I wrote a 4. V3. So, in the middle, or between V2 and V4. So there we have it. V5 is, we're going to stay in that fifth intercostal space. We're just going to continue to go around this left side of this person's chest. So V5 will stay in the fifth intercostal space. But now, instead of being midclavicular, we're going to be right in line with the front of the armpit. There's a name for that. So V5 here. Still that fifth intercostal space. And the front of that armpit we call the anterior axillary. Axillary referring to the arm. So the anterior axillary line at the front of the armpit pretty much. So you come straight down from the armpit, still in that fifth intercostal space. And the V6 is way out here on the edge. We're just going to see some of it. V6. Because for V6, we're staying in that fifth intercostal space again. We're just wrapping ourselves around that left side of that person's chest. I hope I said left side earlier. The left side of that person's chest. Basically, we want to get a good view of that left ventricle. This is mid-axillary. So you drop down from the middle of the armpit straight down into that fifth intercostal space and put that sixth precordial electrode. So let me grab a different color here. Let's see if yellow shows up well. So we have all of our electrodes. Now let me just throw my heart in here, and this is not going to be perfect placement. But let's say our heart's right there. Now, what do you see here? If we take these electrodes, we have a lot of different views of the heart. If we looked at lead 1 again, lead 1 basically tells us, is the heart depolarizing from the right to the left? Lead 2 says, is it depolarizing from the right arm down to the left leg, which it does. Lead 3 would say, is it going from top down? And then, of course, you have the augmented leads. Does it go up toward the left arm, up toward the right arm, or down towards the left leg? But now we have these precordial leads, and V1 is going to be staring over here at the right side of the heart. V2 and V3 are going to be staring at the heart, usually a little bit higher up, maybe the middle. And V4, V5, V6. Now we're starting to move our way down, mainly looking at this left ventricle, not just from the front, but also from the side, from the lateral side. So you're not just getting a front view like you do with the limb leads. Now we're getting a view that wraps itself around the side, so we can see things from this lateral wall as well. So we're getting a much better view. And what that ends up giving us are 12 views now of the heart. And so when you get your ECG printout, you can get it so that it looks like this, and it will. In each one of these boxes, you'll have some ECG, but these boxes are separated very specifically, where in this box, you'll be looking at the ECG from lead 1. In this box, it'll be lead 2, so maybe the waves are a little bit bigger. Lead 3, I won't draw the waves in all of these, but you'll get an idea. And then AVR is here, so everything is upside down. Whoops, nope, that's not upside down now, is it? No, it should be this way, sorry. Well, AVR, AVL, and AVF are here. So your limb leads are the first 6 pictures you'll see. And then you'll see the ECG from the perspective of the precordial leads, or the V leads. V1, 2, 3, 4, 5, and 6. Now, I'm going to delete these for just a second here. All right, just like that. Now, again, you can go back up to this picture, and what we can do when we look at all 12 of these leads and how they're positioned around the heart, we can group them together based on what you're looking at. So, if we look at lead 1, it goes from the right arm to the left arm, V5 and V6, and even AVL, what's pointing up here toward the left arm, these are all positioned way over here on the side. And so these leads give us a nice view of the lateral side of the heart. Lead 1, AVL, V5, and V6. So they show us what the electrical activity looks like from the side. So I'll even color these in a little bit from the lateral side so we can keep them grouped together fairly well. So those are lateral. Now let's look at 2, 3, and AVF. Remember lead 2 is right here. It's going down toward the left leg. Hey, lead 3 goes straight down toward the left leg. And then AVF right here, the augmented limb lead, is going straight down toward the left leg. Those are all going to have a very similar view of the heart. And it's the bottom of the heart, or the inferior portion of the heart. So 2, 3, and AVF are considered inferior. They're not inferior, they're just looking at the inferior portion of the heart. Inferior, inferior. So we'll write those in here. Color those red so that you can keep those grouped together. 2, 3, and AVF. We're going to skip AVR. AVR points up to the right arm. Doesn't give us a great idea of really any specific area. It is useful for other reasons that we're not going to get into. But if we take a look at V1 and V2, V1 positioned right here, V2 positioned right here, they're kind of right in the middle of the heart, and they give us this great idea. I'm going to have to use black, of what the septum, that middle portion of the heart, looks like. So there are septal views, the interventricular septum. Okay, so V1 and V2 are septal, and V3 and V4 now are still on the anterior side, and so they pretty much sit right on top of that left ventricle on the anterior portion of that ventricle, whereas V5 and V6, sorry, right here, are on the lateral side of that left ventricle. V3 and V4 are on the anterior portion of that. So V3 and V4, what we're going to do here in green. So these are anterior views. So we can take these 12 leads and basically group them into 4 main views. The lateral ones, 1, AVL, V5, and V6. The inferior ones, 2, 3, and AVF. The septal, V1 and V2, and the anterior, V3 and V4. Now this is important because when you look at these groups are going to help you define if there's ST depression. Because if you had ST depression in lead 2 and lead 2 only, it doesn't mean anything. Because lead 2 looks at the inferior portion of the heart. If there was true ischemia in that portion of the heart, then leads 2, 3, and AVF, at least 2 of the 3 would have to show ST depression. If only one shows ST depression, it's more than likely just artifact. So for ST depression, for ST changes, I'm going to put a delta S. Delta means the change. So this will refer to both either elevation or depression of the ST segment. So an ST change must occur in at least 2 contiguous leads. Now, hopefully I spelled contiguous correctly. What that means is, so for the inferior portion of the heart, 2, 3, and AVF, you have to have at least 2 of those 3 show an ST change. Now, if we were looking at the lateral side of the heart, 1, AVL, V5, and V6, it only has to be 2 of the 4 leads. For V1 and V2, it would have to be both. For V3 and V4, it would have to be both. So you have to have at least 2 contiguous leads, 2 leads of the same group in order for there actually to be a change. So I'll just write these out for you then. So if we were looking at ST depression, if we saw it in, say, leads 2 and 3, what area of the heart is ischemic? Well, here's lead 2, here's lead 3. They're looking at the inferior portion of the heart. We can go up to our picture and see that lead 2 is right here, going toward the left leg. Lead 3 is here, going toward the left leg. They're looking at the inferior portion of the heart. And so we know that the inferior portion is ischemic. All right. So based on that premise, well, what if we saw it in V1 and V2? Well, that's septal. The septal portion of the heart is ischemic. If it was V5 and V6, that would be lateral. What if we only saw them in 1 and AVL? Well, it's still lateral. And if we saw it in AVF, you can pause this anytime and give this a chance. So if you saw ST depression in leads AVF and lead 3, what do you think it is? It's inferior. The inferior aspect of the heart is ischemic. Now, again, like I mentioned in a previous video, you can have more than one thing going on. If somebody has a blockage in multiple coronary arteries and they're getting a lack of blood flow to a large area of the heart, you may see ST depression in multiple different leads. And it's not just one small area of the heart, but multiple areas of the heart that are ischemic. So try this one on your own. What if we saw ST depression in leads 2, 3, V5, and V6? What would we call that? Well, we would call it inferior or inferiolateral ST depression, because there's ST depression in both inferior and lateral leads. And so that would be a widespread ischemia. There's probably a large amount of blockage, or blockage very high up in the coronary arteries. How about if we saw it in V3, V4, V5, and V6? Well, we call it anterior-lateral. Anterior-lateral ST depression. I'm going too quickly here. Anterior-lateral ST depression. So these precordial leads give us 6 more additional views of the heart and actually give us a little more information about what's going on, especially on the lateral side.